Hi folks, Christian Brindle here, Medicare health plan expert and specialist, and today in this video I'm going to break down for you what the new 2023 donut hole aka coverage gap numbers are and why it matters, what you need to know about it, and what is this donut hole and coverage gap all about. You might have heard about the dreaded donut hole or coverage gap previously. What it is it's a stage of drug coverage that you go into over the course of the year when you use your prescription drug plan through your Medicare Advantage plan or your standalone Part D prescription drug plan enough. Medicare has different stages of drug coverage and it's universal. It's something that's actually designed by the government, and the government actually has these different stages implemented into every single plan with every single insurance company. The first stage that you have is the deductible stage, and that's if your plan has a Part D prescription drug plan deductible. You must meet that deductible before you receive any coverage. Some plans have the deductible apply to all tiers of prescriptions. Some only apply to certain tiers. Some plans don't have a deductible at all. If your plan doesn't have a deductible, you move into the next stage. The next stage you have is what's known as the initial coverage stage. The initial coverage stage is where you just pay your copay. The copay is signed on your plan for that specific tier. So for example, if you have a tier 1 prescription and that copay is a $5 copay for a 30-day supply, you'd pay $5, the insurance company would pay the rest. Say the retail cost of the prescription would be $50. You'd pay $5, the insurance company would pay $45 in that hypothetical scenario. The third stage after that is what's known as the coverage gap, or also known as the donut hole. The donut hole is based off of your total spent over the course of the year, the total cost that your prescriptions equal up to be over the course of that calendar year. It resets in January every single year, and when you get into it, the cost of your prescriptions typically can be expected to go up in terms of what you're actually paying. What the donut hole really is they track the total cost of your prescription costs over the course of the year. And when I say the total cost of your prescriptions, I mean what you pay in copays as well as what the insurance company is paying out in claims. Once you reach this amount, and for 2023, the numbers for it are $4,660, meaning the total spend have to reach $4,660, what you pay plus what the insurance company pays, the total cost. So in our hypothetical scenario, for example, the prescription that you got filled was $50. You paid $5, the insurance company paid $45. So the total spend to get you towards your $4,660 would be $50. Once you enter into the coverage gap, also known as the donut hole, you start paying 25% of the retail value of any prescription from that point going forward, no matter whether it's a generic or a brand name. So in our hypothetical scenario where you're getting a tier 1 prescription filled, but the retail value is $50, what you'd be looking at is about $12.50 instead of your $5 copay. See how this works to where your prescriptions go up, and see how this can be rather detrimental if you're taking prescriptions that have a retail value of $3, $4, maybe even $500 or more dollars a month for the retail value. You start paying 25% of whatever that is. This is a bit of a change from what the donut hole or coverage gap numbers were in 2022, which was $4,430. So it is up a little bit from 2022. There is a fourth and final stage after the coverage gap that your plan can move to called catastrophic coverage. Catastrophic coverage can best be defined by your total out-of-pocket over the course of the year. So once your total out-of-pocket costs reach about $7,400 in 2023, you will enter this final stage called catastrophic coverage, to where you will pay a set copay that is typically very small, or you will pay 5% of the cost of your prescription, whichever one is greater. So at that point, your coverage is better than it ever was. Comparing this to 2022, where the catastrophic number to get you into that final stage was $7,050. So that number has gone up a little bit. So to get you into the donut hole, the number to get you in has gone up a little bit, but to get you out of it, the number has gone up a little bit too. I look at it as a very minor change from the standpoint that it doesn't move the needle too far one way or the other, but it's important that you understand these different stages of Medicare so that way you can understand why your costs might go up over the course of the year. The answer typically and most commonly will be because you might have gotten yourself into the donut hole or the coverage gap. Now this resets, like I mentioned, at the end of the calendar year every year. So January 1, you start all the way back over at your deductible stage and you go through those stages accordingly. This, of course, is not impacted by prescriptions that would be considered insulins that participate in the Insulin Senior Savings Program, which are capped at a maximum of a $35 copay for a 30-day supply, with most, if not all, of Medicare Part D prescription drug plans and Medicare Advantage plans with drug coverage throughout the country. I hope this video has been helpful, informative. I hope you have a much better understanding of the donut hole / coverage gap after watching this video and how it has impact over your prescription drug coverage. If you found this video helpful, enjoyable, insightful, do me a favor and hit the like button on this video. It helps more people like you find the video easier. It helps with the YouTube algorithms. Make sure to comment your thoughts down below. Is the donut hole a good thing? Is it a bad thing? I would assume most of you feel like it's a bad thing, and I would agree with you. Make sure to subscribe for more Medicare content, and we'll see you next time, folks. Thanks so much for watching, and have a great day.